This is Radio Health Journal. I'm Nancy Benson. This week, why are preventable heart attacks often not prevented?
Over 75% of people got the question wrong, what causes a heart attack? Most thought that it's just about cholesterol.
Misunderstanding heart attacks when Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
The more I read about Roosevelt, and there was always this woman just hovering at his shoulder, I thought, what a fabulous life she must have had. How interesting to work for Roosevelt in the White House during that tumultuous decade.
Missy LeHand, her legacy as FDR's right-hand woman lives on. Then,
Millicent Patrick had to make a monster that not only looked realistic, scared people, but had enough humanity in him that people would feel for him.
The previously untold story of a Hollywood icon. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Heart disease is America's #1 killer, but the way we look at heart disease keeps us from doing as much about it as we could. Heart disease builds up silently in a person's body over decades and often strikes without warning. It seldom produces an heroic years-long struggle, so we often don't understand the impact.
Imagine 4 jumbo jets crashing every day for a year, killing everyone on board. Somebody would do something about that, right? Well, that's how many people die of heart disease every year, and over 80% of those deaths are preventable. So we wanted to understand where the disconnect was.
Dr. Andrea Clemis is Chief Medical Officer for the national concierge medical firm MDVIP, which sponsored a national survey on exactly that. What misinformation is out there that keeps us from preventing heart attacks?
What we found was that over 75% of people got the question wrong, what causes a heart attack? Most thought that it's just about cholesterol. But in fact, most heart attacks happen in people with a normal cholesterol level. The other piece of that puzzle is inflammation, and that's what people didn't know much about.
When heart attacks strike, we often picture victims clutching their chests and falling dead on the floor. That may lead a lot of people to conclude, when your number's up, there's not much you can do about it.
Over 70% of people in this survey knew that heart disease was the #1 killer. Interestingly, though, more were afraid of getting cancer and dying of cancer than of dying of a heart attack. Over 60% said that they knew the risk factors for heart attacks and they knew their own risk. But 62% of people failed the heart attack IQ survey. So they think they know what they know, but they don't really know enough.
That leads a lot of us to focus on low-fat foods, when fats aren't always the problem. In fact, the MDVIP survey finds that more than half of us believe that people with heart disease should eat as little fat as possible.
All fats aren't bad, and so I think that's the misconception. There are some good fats, and in moderation, things like salmon or nuts or avocados can actually help you prevent a heart attack.
What's more, if we're paying attention only to fats, we're likely to eat way too much sugar. Many food processors add extra sugar to low-fat foods to maintain their taste. And sugar has been shown to promote low-grade chronic inflammation in the body. Clemis says that's the real heart disease villain.
Chronic inflammation can make you more predisposed to build up that plaque in your artery. And, acute inflammation is a good thing. Like when you get a splinter and it gets all red and swollen, it's because your body's fighting the bacteria and the bad things around the splinter and trying to get rid of it. But chronic inflammation, like from smoking, from bad diet, from not exercising, from uncontrolled diabetes, all those things, that chronic inflammation will not only cause the plaque to grow, but it will try and wall off that plaque, just like the splinter, except that it will also irritate that plaque. And if the plaque breaks open, it will form a blood clot, kind of like when you cut yourself shaving. You get that blood clot. Well, that's what will happen in your artery, and that's what clogs the artery and causes the heart attack or the stroke.
Yet most people are totally unaware of that. Unlike some other diseases, Clemis says heart disease suffers from a surprising lack of awareness. One other surprising fact is the relative lack of attention given heart disease by women. Typically, women are households' health CEO and are more aware of family health than anyone, but not with their own heart disease risk. Clemens says there are probably several reasons.
Women are protected against heart disease premenopausally, so I think they don't really think about it till later in life when it's probably too late. And also, stereotypically, having a heart attack has been a male disease. And so, especially also since the symptoms of a heart attack are common that we all know about for men, the elephant on your chest, and women may have some atypical symptoms, like being nauseated or just having jaw pain, and they may not run into the doctor as quickly with these symptoms, which is probably why women die from their first heart attack more often than men do.
So what should all of us be doing about inflammation if that's really the bad guy when it comes to heart disease?
Like a lot of the steps we talk about for healthy living, eating healthier, exercising, and I think with exercise, it's something you have to find what you will do, what you like, so you can make it a good habit. Making sure you go to your dentist. I think the most important thing, though, is going to your physician, your primary care physician, and like an MD VIP physician across the country who will check those inflammatory levels and can understand if your level is elevated and then work with you, whether it's diet and exercise, whether it's fixing your sleep patterns, whether it's decreasing your stress, all of those things, or do you need medication like a statin to decrease your cholesterol or other things to help decrease that inflammation.
However, Clemens says even though she believes blood tests for inflammation should be routine, you can't expect your primary care doctor to do one without asking for it. Insurance often won't cover it. But she says it can tell you far more about your heart attack risk than many other risks you may imagine.
You can imagine if your level is elevated, if you have bad diet, bad exercise, uncontrolled diabetes, family history, all of those things. You can imagine your level could be elevated, but it may not. It's just like knowing, do you have diabetes or not? You need to check your blood sugar and what your blood sugar level is over a period of time. You need to get a blood test to identify if you have elevated inflammatory levels. And if you take the quiz at mdvip.com/heartattackiq, you'll not only get the answers, but you'll get a sheet that you can take with you to your physician so that you have the right questions to ask.
The webpage for the quiz, again, is mdvip.com/heartattackiq. You can find a link on our webpage, as well as information about all our guests at radiohealthjournal.net. You'll also find archives of our programs there, as well as on Apple Podcasts and Stitcher. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion into users' ears, and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new law clause that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Facebook and Twitter, and check iTunes for a library of past programs. Plus, you'll always find podcasts of our segments, information about our guests, and the latest health news at radiohealthjournal.net. Join us again next week for another edition of Radio Health Journal.